A lot of people ask me, when should I get a bone density test? That's the major test that we use to evaluate your bones to see if you have osteopenia or osteoporosis. So those are pre-osteoporosis is osteopenia, so you've had some bone loss. And then osteoporosis is where you have enough bone loss to put you at risk for breaking a bone. Now, there are different standards for when you should start getting tested. For most women, it's around the age of 50. But if you went through menopause earlier than the age of 50, then you too should probably get a bone density test, because bone loss can happen earlier with menopause and even with some people with lots of risk factors. So for most women, it's around the age of 50, or if you've had or gone through menopause, started menopause. But men should also get tested. My father had osteoporosis, and we often forget about men. So I always tell men who particularly are slender built, have a history of osteoporosis, that they should get tested probably in their late 60s or 70s. So it really varies, but there are some good guidelines for when you should get tested.